Welcome to Advocacy in Motion. If you've seen our program before, you know that we're here every week to give a vision and a voice to nonprofit organizations and individuals making an impact in our community. And before I introduce our guest host today and our guest, I want to say thank you to our presenting sponsor, Niagara. Niagara has been with us from the beginning, and to date, they have helped us share the story of over 30 nonprofit organizations, and their commitment through the end of the year will allow us to do at least that many more. So we want to thank Niagara for their support, for allowing us to present this program every week. If you don't know, Niagara is the leading manufacturer and distributor of water-saving plumbing products. Their work with affordable housing program is extremely important, as they can save nonprofit organizations water cost, which goes to a much greater cost than just paying for the water bill. So we want to thank Niagara for their support of our program and their support of nonprofit affordable housing programs, including the new Volunteers of America Oaks projects in the Oak Cliff District of Dallas. So thank you once again, Niagara. My guest host today, you've seen her on our program before, is Ranson. And Ann, I usually go through a litany of all the stuff you're doing in the community and all the help you do for nonprofits. So rather than me say it, why don't you tell people what you're doing now and what's new with you?
Well, thank you, Tommy. I'm so excited to be a part of this program and to be able to highlight some of the nonprofits. I do specialize in the nonprofit world as a consultant and a coach. I also do personal coaching and do something called the transformation game. So I stay busy. I like being, my whole mission is to make a difference. And so I feel like when I can help a nonprofit be more successful or more focused, then that's my way of making a difference. And so it gives me great joy.
Very good. Speaking of making a difference, you have a very special guest here that is making a big difference in our community. If you would like to introduce your guest.
Yes, I'm so excited to introduce Brian Hawkins, who's the CEO of HHM Health. He's relatively new to Dallas, only being here a couple of years, and I'm really excited to talk to you today about the impact that HHM is having in the community. So welcome, Brian.
Thank you.
Yeah.
And thank you, Tommy.
Yeah. Glad you're here.
So let's start with the easy question. Tell us the mission. Tell us about HHM and what y'all do.
Sure. I'll give you the official mission statement,
Okay.
and then I'll talk to you about a little bit of what we do. HHM provides quality health care to all of our neighbors with love, compassion, and respect. And that's one of the things that drew me to the organization. We started off as Healing Hands Ministries. We shortened the name to HHM Health because we wanted to know, when I was first asked to come here, I was said that, I thought it was a religious organization. I didn't realize it was a federally qualified health center. So we wanted to make sure that we were able to reach everyone. We shortened the name down to HHM Health. We are, as I mentioned, a federally qualified health center. And what does that mean? That means we get a portion of our funding from the federal government to care for those who are underinsured or who don't have any insurance. And they were originally designed to be in urban and rural areas in the United States of America, started during the Kennedy administration. At our particular location, we have primary care, we have pediatrics, we have a new pharmacy now, which we call a 340B pharmacy, which drugs at a very, very low cost. We have optometry, we have imaging to include mammography. We have behavioral health, and we have dentistry. So we have the whole gambit of healthcare in our organization.
Wow. And how many of those services are new since your tenure?
Since I got here, we've really expanded behavioral health. Mm-hmm. We've added imaging to include mammography, bone density, and x-ray. We've also added the pharmacy, which has been in service for about 90 days now, which offers extremely discounted medication for our patients who sometimes have to make a choice between food and medication. And we don't want them to have to make that choice, so we added the pharmacy to our location, as well as we've expanded. We've added 2 more sites. We've added a pediatric site, and then we added a site in Oak Cliff, Trinity Basin, adjacent to Trinity Basin Preparatory Academy.
Okay. So talk a little bit about your journey to get to HHM. You said in the beginning you thought maybe it was a religious organization. You weren't really sure. So what really drew you to come to Dallas?
Well, this was more of a God thing more than anything else. We say our steps are ordered. HHM is a faith-based organization. First and foremost. One day I was sitting in my office. I've been in healthcare for approximately 30 years. And I was working at a federally qualified health center in Maryland. And I got a phone call from a recruiter and asked me what I consider Healing Hands Ministries. And I thanked the gentleman, told him why I appreciate he looking at my resume on LinkedIn and thought enough about me to lead a religious organization. I wasn't a preacher. So he said, no, you had it confused. This is a federally qualified health center, and that's the name of the organization, faith-based. Really wasn't interested in relocating to Dallas, Texas. I just bought a new home in Maryland. But recruiter kept calling me and kept asking me to consider it. One of the things that I looked at the mission of the organization, looked at some of the great things that it was already doing. But one of the things that really enticed me is he said the board wants to come down, but they want you and your wife to come down. And they want to meet your wife as well. So that spoke volumes to me about the organization, who didn't just have an interest in me; they had interest in my family. Yeah. And I thought, well, is this truly a God thing? Because I was supposed to come down, then you had the Snowmageddon here in Dallas. And I said, well, maybe God's speaking to me. He said, you don't need to go down to Dallas with all the power out. But about a week later, convinced me to come back down again. And Priscilla's my wife, we just had a wonderful time, had a great interaction, and just got a real good feel about the organization. And we really prayed about it, for about a month or so before we made the decision. So we think this is, we don't think this is the right decision because our steps have been ordered.
Yeah, wonderful. So you mentioned that you're an FQHC.
Yes.
So tell us how it all works, because one of the benefits is the affordability of the services. And so how are you able to do that? And can you give any examples that might appeal to listeners or viewers to understand, like, how much money could they save? Maybe they're one of those people who's foregone medical treatment for a long time because they don't have money.
Absolutely. What happens is that there are well over 1,000 federally qualified health centers in the United States currently. And the federal government, through Health and Human Services, funds these health centers to care for the underinsured, or those who don't have insurance, in the form of a grant. We call it a 330 grant, which is a block of money that they give you to help you financially. The other thing is our Medicare and Medicaid rates are higher than those in the private sector. For instance, if you go to a private sector doctor, Medicare, Medicaid, they may get reimbursed typically for an outpatient visit about $80. Our reimbursement is $180. Not for us to make a lot of money, but we are cared for those that sometimes we might not get paid for. For instance, about 40% of my patient base are those who don't have any insurance. Oh. And with that, we have a slide fee. Number one, we don't turn anyone away even if they can't pay. So we won't turn you away if you can't pay. But the slide fee is a fee that, based on where you fall in the poverty level guide, you can pay as little as $35 for an outpatient visit. And so that money that we get for those Medicare, Medicaid on the back end, where our rate is a little bit higher, helps compensate for the medical care for those who can't afford to pay or only paying $35 for an outpatient visit.
What would you say to those people who haven't had medical treatment in a good while? What would your invitation be to have them come to HHM and seek out medical advice?
That's a great question. I think the thing that makes HHM different than other healthcare organizations is in our mission statement, is how we hire employees, and it's how we address each other. First, with love. Second, compassion. And third, respect. I believe, as head of the organization, that healthcare is a right for everyone. Being that healthcare is a right, we have to treat everybody with dignity and give them the healthcare they deserve. And we're one of the few organizations that you can get everything from dental to your eyes checked. We have this phenomenal new optometrist coming in from the VA, used to dealing with people with low vision, glaucoma. You get your medications for much cheaper, as well as you get everything you need. And then we have referral agreements that if we can't do it, we can refer you to a good provider who could do it. Those specialty things like cardiology, podiatry, things like that. But it's a one-stop shop essentially for all your healthcare needs.
So people should not be afraid to reach out and to come to your organization.
Absolutely. People should never be afraid to reach out. We consider ourselves advocates for the patient. Because most of the time you go to the doctor, nobody wants to go because nobody wants to get on the scale. I know I don't want to get a scale until I'm overweight. Nobody wants to give blood. And nobody wants to get a shot, in the arm. On the flip side of that, we want you to come because even though we don't like to do that, I would prefer to give you that shot or to draw some blood to find out what's going on to keep you from being in the emergency room or to having surgery. And that's the trade-off. And if you come to an organization where people are doing it in a loving way, I think it makes all the better when you're there, because nobody wants to go see the doctor, but we all have to. We're all getting older or something's happened that we just need medical care.
All right. Thank you so much for that so far. When we come back, I want to ask you about a special story that was in the morning news recently. But first, I want to take a minute to thank another one of our sponsors, Piranha Haven. Piranha is this wonderful spiritual gift shop in downtown Richardson. And Piranha means is Sanskrit for life force and energy, and that's what you find when you walk in the store. You'll see free trade merchandising, local artwork, all kinds of crystals, incense, and on the fourth Saturday of every month they hold a psychic fair. And you can go to piranhahaven.com and see all the things that they do. Pretty soon you'll be able to shop online. And then you can see the psychic readers. You can book psychic readers. And you can also stop into the shop at any time. It's at 107 South McKinney in downtown Richardson. And when you go in, if you see Alex, tell her dad said hello. This is a family business. And if you hear the baby crying, that is our newest shop manager, Sky. So she will be taking over shortly. So we want to thank Piranha Haven for all their support over the years and continued support, and allow us to talk more about nonprofits as we go forward. So thank you, Piranha Haven. Recently, there was a story in the Dallas Morning News. I think I saw a video clip of it, of your organization hosted a baking class, a cooking class, to teach immigrants from, I believe, Ruha, is that where they're from? Is that
Burmese? It was
Burmese,
yes.
Burma, to make birthday cakes, something they'd never done. Now, in the grand scope of everything you do, this doesn't sound like a really big deal, but to me, it spoke volumes of the caring that your organization has for individuals, whether they're from this country or not. But for someone at your organization to think of doing this, to actually do it, and to teach these women, and then the video I saw, they were so appreciative. Tell us a little bit more about that aspect, not just the baking class, but the care that goes in from your organization to everything you do.
Absolutely. You asked me earlier what drew me to the organization. I'm constantly talking about love, compassion, and respect. Healthcare is not just about a pill. It's not just about getting poked or drawing blood. It's about how you feel, not only spiritually, but how you feel emotionally about yourself and about your community. One of the things that we have a great volunteer corps that comes in and really helps pick up the mantle from where medicine traditionally falls off, and really caring for the whole person. We have 68 different languages spoken at our organization, so we have a lot of different cultures and blends of people. And one of the things that we found is people who immigrate to the United States many times haven't used what we take for granted, a stove, oven, plumbing, having running water in the home. So what we do is we bring some of those folks in, and we actually teach them how to cook and to do different things using modern appliances that they don't have in their country. The birthday cake was the second one. The first thing we did is we taught them how to make pizza. So we used the oven, we taught them how to make pizza. But one of the things that we heard constantly is a lot of children are as they're coming to the United States, people are having birthday parties and birthday cakes, and what is that? What is a birthday cake? And so one of our volunteers took it upon themselves to gather some of the families together and really train them on how to use an oven, how to make a birthday cake, and really celebrate the individual, but celebrate the family, and then celebrate them coming to a new culture, to a new country. This is what we do here. So it really goes into caring for those individuals. And it's amazing. You're teaching them how to make a birthday cake, but you're also getting to know something about that individual and helping with their care some kind of way, because as you're cooking, they're talking to you, or we don't do this, or, you may not find out that they may not have a healthy diet, or they may not have something in the home that gives us an opportunity to talk to them and say, hey, let's do this. Let me put you in contacts, or you can, you can get this, you can get that, because we want to care for the whole person. And, going back to what drew me to the organization, you don't find many organizations who want to do that, or have a core of volunteers who want to care for the whole individual, because that's what separates us, right? If I go, I can go to get my yearly physical. It's more of a transactional type of thing. But when you have someone who's developing a relationship with you, then your healthcare takes a different turn. So it's about us developing relationships and trying to develop a relationship with each one of our patients. Not just, hey, I want to get your blood pressure, but why is your blood pressure like this? What are you eating? How are you eating? Where do you shop? How can we get you healthy options? How can we connect you with maybe a food pantry that can help you with healthy options? What kind of activities that you're doing? Hey, we do exercise classes. It's some little things that you can do. You don't have to join a gym, but this is what you can do to exercise. Maybe that help. What's stressing you? What's going on? Maybe you don't want to come and see a behavioral health therapist. Maybe you just need a hug, and this is all you need. We want to be able to do that for our patients.
I think that's wonderful, and like I said, the cooking class just sort of speaks to the total care of the individual that your organization provides.
It kind of reminds me, when I was in Spanish media, we used to talk about immigrants that were acculturated, I think was the word. And it sounds like there's a lot of that going on, of people coming from a culture where they don't celebrate birthdays. And so yes. A birthday cake is like, well, what is that? Oh, okay, well, let's have a piece of cake. And yet it seems like you're helping people not just with their physical health, but feeling comfortable. I think that's where that love, compassion, respect. I love those three words, particularly, in combination, because we all want love, compassion, and respect. So is that intentional, that acculturation aspect? And I think I'm getting that word right.
Absolutely intentional, not just for immigrants, and I know a lot of times we talk about that because that's a big segment of our population. But something that I it just hit me like a ton of bricks. I was, you and I talked about this, Ann, when we started with the imaging center. I didn't realize that Medicare only pays for so many mammograms per year after you get to a certain age. And if you have a history of breast cancer, you may want to get more than that. What am I saying? I didn't realize for our senior population, no matter how much wealth you may have, it becomes very expensive to do certain things like get a mammogram, or how much are your prescriptions costing you that you have to pay extra for, that Medicare doesn't pay for, that you need to survive. So it's about, okay, how do we get into another culture to let people know, this is not a free clinic. This is a clinic to help you, a health center, not a clinic, a health center to help you, and to really start speaking that language a little bit different. So as we care for, and as I mentioned, state our neighbors. And who are our neighbors? Our neighbors are everyone, and we have a little bit of something to offer for everyone, and we're really trying to approach that in a different way. How can we get more folks to say, hey, come get your medication here, where you may pay out of your pocket $200, you can come to us and get that same medication for maybe $30. Well, can you afford that $200? Yeah, but if you can save it and put it towards something else, that's great, right? Maybe you save it and you put it to the college fund for your grandchild. Or you take that extra vacation, although you can afford it. Why spend that if you don't have to, and it's an organization that can help you?
Well, in fact, if I may, you and I did a little test. We went over to the pharmacy. There's a couple of prescriptions I take that are on the higher end. And I don't remember what the exact numbers. Maybe it cost me $60, and with y'all it was going to cost like $10 or $20. And so I'm going to be switching. And so I think part of what I hear you saying is this is not just a clinic or center for the indigent. You serve anybody who has health needs. Is that right?
Yes, ma'am. Anyone who has health needs.
Yeah.
First of all, tell us where you're located. Let's start there, and we want to repeat this many times and so everybody know who you are and where you are. So how do people find you?
Well, they can find us on our website at hhmhealth.org. You can also call us at 214-221-0855. We are on LinkedIn and we're on Instagram as well. Currently, we have 4 locations. One at 5750 Pineland. That's across right behind the American Heart Association. We have another location at Greenville and Royal. We have another location in Wood Hill Office Park. And we have our 4th location at Jefferson and 8th Street, adjacent to Trinity Basin Preparatory Academy. And we're going to soon, by the end of the year, opening up, keeping our fingers crossed, 2 additional locations. One on Home Street in South Dallas, adjacent to another nonprofit called Viola's House that serves women and children, and we'll be doing some OB and gynecology there, as well as some primary care. And we recently connected with another nonprofit, Hope Cottage, and we'll be opening up a clinic in Hope Cottage. So we're very excited.
Oh, that is exciting.
Yes.
So opening up new locations costs money.
Yes.
So what support do you need from the community? How do you raise funds? Because I'm guessing the government does not cover 100% of your costs. So talk to us about how the community can help support your efforts.
You can always donate. On our website, there's a donate button where you can donate either money or time. Your time is very valuable, or connecting us to other resources. We have a annual luncheon that we try to raise a lot of money for. This year was very successful. Scott Hamilton was our guest speaker this year. So we have our annual luncheon, but we go out and solicit funds from major corporations and foundations to help support us. It's funny, we're the 2nd largest FQHC in Dallas, but the lowest funded from the federal government. So we rely heavily on those donations from private citizens and companies to help our organization grow. And we have been really blessed with our partners. We have a potential with the Hope Cottage that we received a blessing through one of their donors to build a clinic for us. And all we have to do is occupy that, and we're looking to receive some blessings so we can do some build out for the Home Street location adjacent to Viola's house.
Wonderful.
We've had some notes here and we've talked about quite a few things. Tell us what we missed. What would you like for our audience to know about your organization and services that we haven't talked about?
The one thing I think that's missed quite a bit is, you heard me change up from clinic to health center. don't want us to be referred to as a clinic, because many people get the idea of a free clinic or a clinic where you're gonna be treated as a number rather than a person, and that is not HHM. We offer the best care that you can get any place in Dallas. However, we are just blessed with the opportunity that we don't turn you away if you can't pay. We take pride in all of our locations. Follow a format like Chick-fil-A. They look the same, have same color schemes, are very clean. That's important to me. It's important that we treat folks with respect. So unless I told you that it was a FQHC, you would think it was any other doctor's office, upscale doctor's office in North Dallas that you were going to. So I don't want people to ever associate us with a free clinic. We are a healthcare facility that can provide care to anyone who wants to care. And by helping donate, you can keep, folks can hear my voice. If you could donate or give of your time to help keep us in a position where we can do that. And I think we've been very successful. When I got here 2 years ago, we were serving 13,000 patients. Last year, we served 17,000.
Wow.
And we're on track to, and these are unique patients, serve 20,000 unique patients this year. So, people are hearing about us. The word is getting out that we offer great quality of care.
Ann, is there anything else you'd like to ask?
I think that's all the prepared questions that I have. I'm so excited you're able to be here. I think y'all have such an important story, and there's such a great need. And just going back to those mission words of love, compassion, respect. And I think in, today's society where things can get a little crazy, I don't know, for some reason the compassion and respect really stand out. And of course, I've been in your operation on many occasions, and I can say to anybody that it is a beautiful place. You will feel comfortable, you'll feel welcomed, you'll feel respected, and I think those are such important qualities in today's society. Well, I guess in any society, but it just seems more heightened because I don't think we always get to experience those things every place we go.
I agree with you, and if I could do a shameless plug for Ann Ranson and her consulting group, she played a big role in helping us gel as a team and working with us. And talking about compassion and respect, you do a lot in what you do and how you help facilitate us and help gel the group. And I can't say enough about that. And thank you for what you do. So if you haven't used Ann, use Ann Ranson.
Well, I tell you what, you're exactly right. I'm so glad to call her a friend. We've known each other for years. And she has been very responsible for bringing us many guests in the nonprofit, and we were able to share their stories because of her involvement, and not only as a guest host, but kind of behind the scenes and giving us direction to bring more people on. So,
oh, shucks,
thank you
y'all
for
are going to
that.
make me cry.
Thank you, and too bad we can't pay you for this, but it's great. You get rewarded.
From
I
the
know
heart.
You
From the heart.
We're all doing this. Well, thank you both so much, Brian and Ann. Before we go, I just want to say that we are so pleased with our podcast and want to thank our sponsors, Niagara and Piranha Haven. To date, we've put out the stories of over 30 nonprofit organizations, including the Medal of Honor Museum in Arlington, Texas, Scottish Rite Hospital, Ronald McDonald's House, the Dallas Mavericks Foundation, and you can now go to wherever you get your podcast to see or listen to all of our previous shows. They're all archived, and if there's someone there that you want to see, please do. You can go to YouTube or iHeart Spreaker series and just key in Advocacy in Motion podcast, and you can go back and see all the wonderful work these 30 organizations have been doing, and we've been fortunate enough to be able to share their stories. So thank you again, Ann, Brian, and we look forward to seeing you again.
Thank you. You certainly will.
Thank you.